My position is against conscientious objection. I mean that I don't think that doctors should be allowed to object to performing certain professional activities on the basis of their personal moral views. What often happens is that by appealing to their conscience, healthcare practitioners claim a right to be exempted from performing certain medical procedures. So the most typical example is that of abortion, but as our society becomes more multicultural, multi-religious, we have many more cases of conscientious objection today. For example, we have some Muslim doctors who might want to object to medically inspecting patients of the opposite sex or patients intoxicated by alcohol. The problem is that if we start allowing conscientious objection in certain cases, it's very, very difficult then to limit conscientious objection in other cases. This is obviously a very unrealistic example, so I thought, suppose that there is a doctor who, for some personal, moral, or religious reason, objects to providing vaccines or antibiotics to their patients. For example, because this doctor thinks that viruses or bacteria have some sort of moral status whereby it is wrong to kill viruses or bacteria. I don't think that anyone would think that this doctor should be allowed to object simply because providing antibiotics or vaccines is part of her job. But the problem is that some people will be willing to allow doctors to object to abortion on the basis of personal, moral, or religious views about the morality of abortion. The problem is that if we start allowing conscientious objection in certain cases, it's very, very difficult then to limit conscientious objection in other cases. Before I made the example of Muslim doctors who object to performing, to inspect patients of the opposite sex or patients intoxicated by alcohol. I don't think this is acceptable. But again, what is the difference between this kind of objection and the objection of, say, a Catholic doctor to abortion? I don't see any criterion for drawing a line and consider some of these objections permissible and some impermissible. And for this reason, I think that simply conscientious objection should not be part of the medical profession. Should only think about what a profession is, what a profession requires, and what patients need for their health. And this is all what we should expect doctors to care about.